A very good morning to one and all present over here.
Good morning.
Good morning, Dr. Mitali. So nice to see you after ages, means after decades, I say. Really,
Yeah.
it's an honor that you have accepted our invitation and been over here. Thank you so much. Thank you so much, ma'am.
Thank you for giving me that opportunity. It's a pleasure to be able to join in today and talk about a very topical subject.
Thank you.
So,
Thanks for
are
joining.
we okay to start now?
Just one moment, just a second, then we will.
Sure.
Yeah. So, a very good morning, everyone. Welcome to the day 4 of the long 5-day FDP program on the theme Leadership, Exerting Influence, Not Authority. So yesterday we had with us Professor A.K. Sir, who take us through to the various issues related to how to build up academic alliances and how the role of leadership is creating a pivotal impact on those academic issues and alliances. In the second session, we had with us Professor Sunil Sarangi from XLRI Jamshedpur, who took us through the various issues, again, exerting influence, how to do that. And he came up with certain neuro communication approaches to act as a fit in terms of dealing with such issues. In the third session, we had with us Professor Ashin Mishra, the Dean of School of Management, who engaged the entire audience with his story, with his rendition with Dr. Kalam, and how the role of leadership has evolved with transition. So today, in the 5th day, and we begin with the session 1 with Dr. Mitali Das, who is right now a consultant psychiatrist at Edward Southeastern in Australia, as well as he is a consulting suit at Bedwork and Monash Hospital, Greater Melbourne, Australia. Dr. Das is a great adult psychiatrist. She has graduated from SCB Medical College from Cuttack and worked in IGH and subsequently ESI Hospital before moving on to Australia in 2000. She completed her master's in psychological medicine from Monash University, Australia, and fellowship in psychiatry with the Royal Australian and New Zealand College of Psychiatrists, and has also worked in emergency psychiatry, crisis team, secure extended care and rehabilitation, as well as inpatient and community setting in Monash Health and Peninsula Health, Melbourne. Dr. Das has a range of interests, including treatment of high prevalence disorders, including depression, bipolar affective disorder, anxiety, OCD, as well as psychosis. She has trained herself in transmagnetic stimulation and has a great interest in women's mental health and mood disorders. Currently, she has also her private practice in Epworth Hospital, Camberwell, Southeastern Consulting Suits, Borthwick and Monash University in the Clayton campus of Australia. Thank you, Dr. Mitali Das. Thank you so much. Really, I, on behalf of KIT School of Management, as well as KIT University from our honorable founder, Dr. Achyuta Samanta, I welcome you to this 5-day long FDP program on leadership and excellence. Thank you so much.
Thank you, Dr. Shikta Singh. It's a pleasure indeed and a great honor to be able to speak on this relevant topic, especially from my home state. It's indeed a great opportunity for me, and I consider it a great honor. Are we happy to start?
Yeah, we will.
Okay, I will just share my screen now. Okay, I would like to make this topic very interactive today. Are you there?
Yes.
Yeah. So what I would like to do is I will speak briefly on the topic and give some of the symptoms and discuss what we generally do. And then I will have two case studies that I will give brief outline about, and we can discuss that as to how to approach and manage. And so that it, and feel free, we can have a discussion session after the case history. But if there are any issues after that that need discussion, we'll have hopefully have some time in the end. So the topic today is modern day stress, a toxic evil. Stress, the word sounds so familiar, doesn't it? Everywhere you hear about stress on a day-to-day basis, be it your workplace, home, school, university, or even in social chit chats, we hear the word stress multiple times each day. Over the past few decades, this has become a very commonly used term, not only in academic discourses, but in everyday life. And this has become more common in globalization and postmodernism. The word stress is usually used to describe the pressure experienced by a person in response to life demands. And these demands are generally referred to as stressors. Stress and trauma affect the physical and emotional well-being of millions of people in different parts of the world, including India. It is difficult to get an accurate information about the prevalence of stress and trauma associated impacts because of the complex events and the variation of in individual responses. What that means is that what you might find stressful may not be seen as stress by somebody else, but that does not mean that you do not experience that stress.
Sorry to interrupt, Dr. Das. Are you sharing the PPT?
Yeah?
No, it's not visible.
Or is it not?
No, I just
let me go back to, where is the Zoom?
a share screen at the bottom. Yeah, it started now.
Started now? So let me go back to my PowerPoint.
Yeah.
Is that visible now? I'll just quickly go back to the first few then.
It's okay. We can.
Okay, so as we were talking about, these are the stress, the life demands that cause stress are known as stressors. Stress and trauma affect the physical and emotional well-being of people in millions of people around the world, and that includes India too. It is difficult to get an accurate information about the prevalence of stress and trauma and associated impacts because of the complex events and the variation in individual responses to life demands. Stress can be due to physical, mental, and emotional factors. It can be external, caused by environmental factors or psychological and social situations, or internal stress related to medical illnesses or medical procedures. What stress does is initiate a fight or flight response, which is a complex reaction of the neurological and endocrinological systems of the body. Continuous stress without relief can result in a condition called distress, a negative stress reaction that can lead to physical symptoms such as headaches, loss of appetite, increased blood pressure, chest pain, sexual dysfunction, problems with sleep. So many a times you will hear people talking about getting headaches because they've been so stressed over the last few days, not able to sleep, not interested in food, and sometimes experience chest pain or palpitations. Stress can also cause and influence a broad range of physical health conditions, such as heart problems, diabetes, poor healing, irritable bowel syndrome, which is characterized by diarrhea, mental disorders such as depression and anxiety. What causes stress? Stress is actually your body's way of responding to any kind of a demand or a threat. When you sense danger, it is real, whether it is real or imagined, the body's defense system kicks into a high gear in a rapid automatic process, which is known as the fight or flight reaction or the stress response. So the stress response is actually the body's way of trying to protect you. The most likely causes of the stress are being under lots of pressure, whether it is work or emotional, facing big changes, worrying about something which is over the top, because normally we worry about little things as well. But when it becomes stress, you worry over the top about something that does not need that much of concern. Not having much or any control over the outcome of a situation causes a lot of stress. Responsibilities that you find overwhelming and are not coping with. Not having enough work or activity also can cause a lot of stress. And in times of uncertainty, when you are not aware of what is going to happen next. Generalized anxiety disorder is characterized by persistent feelings of fear and worry about everyday things that are difficult to control. Epidemiological research shows that the median age of onset of generalized anxiety is twice as prevalent in women than in men. Children do experience anxiety, but the prevalence is about 5.7 to 12% for children under the age of 18. Generalized anxiety is more common in individuals who are separated, divorced, or widowed, which goes to show that social support is very important in relieving anxiety. Low educational attainment and unemployment are consistently associated with generalized anxiety. The functional impairment associated with generalized anxiety is comparable to that of a major depression. So how do we diagnose generalized anxiety? It has two main components: excessive worry and persistent restlessness. So when we worry excessively about daily routines, relationships, family, finances, work, study, illness, or world affairs, then that is grouped under the anxiety disorder. Probably these are things within their control that are going wrong, and people are catastrophizing in highly improbable ways. Persistent restlessness is a feeling of being on the edge and experiencing muscle tension. And you see that as headaches or body pain, backache, symptoms such as those. So DSM, which is the Diagnostic and Statistical Manual for Psychiatry, It is basically the Bible or the Gita of psychiatry that helps in diagnosis. Generalized anxiety, according to the DSM, is excessive anxiety or worry, apprehensive expectation occurring for more days than not for at least 6 months. And this anxiety or worry could be about a number of events or activities such as school or work performance. The anxiety and worry are associated with 3 or more of these following symptoms: feeling restlessness, easily tired or fatigued, difficulty in concentrating even on pleasant things, getting irritable, experiencing muscle tension such as headaches, backaches, sleep disturbances. Generally, what happens is you are unable to fall asleep or relax. Generalized anxiety, on an average, is only diagnosed possibly 10 years after the onset, at which point the patient has gone to doctors due to comorbid issues such as panic disorder, depression, or chronic pain disorders. Initially, when someone is anxious, they try to sort out themselves without seeking any help. But when it gets to a point that they are not able to manage their anxiety and it is interfering with their day to day life, work, or relationship, that is when people start seeking help. People with generalized anxiety seek reassurance to reduce or the immediate worry. They try to avoid events that could have a negative consequence and spend a considerable amount of time preparing for the events to minimize their worry. Therefore, all patients that are diagnosed with anxiety should be screened for depression as well, because by the time they present with their concern about anxiety, it has been impacting on their life and they are uh, experiencing some symptoms of depression too. Although generalized anxiety is one of the most common mental disorders, there is no brief clinical measure for assessing the anxiety. The GAD-7 is a valid and efficient tool that we use for screening anxiety and assessing the severity in clinical practice. There have been several works carried out to identify the brief self-report scale and identify probable cases of anxiety before they get into depression. What is the GAD-7? It's a self-report scale, and it is validated diagnostic tool that detects a patient's latent anxiety and how this has been affecting their ability to respond to an item in a particular manner. So there are 7 questions: feeling nervous, anxious, or on the edge, not being able to stop worry or control your worrying, worrying too much about different things, trouble relaxing, being so restless that it is hard to sit still, becoming easily annoyed or irritable, feeling afraid as if something awful is going to happen. So these are the questions that are asked for this in the self-reporting scale, and people can rate it as not at all to partially, sometimes, every day, most of the days, or nearly every day. So how do you differentiate generalized anxiety from a non-pathological worry? As I mentioned before, worry is inevitable. It's a normal emotion. But when it becomes in excess and interferes with day-to-day life, then it becomes a pathological or generalized anxiety. And this can be tricky to differentiate. How do you know? Especially if you are a little more anxious than others. or whether or not your anxiety is significant enough for you to qualify as a disorder. So investigations of the boundary between generalized anxiety and normal worry have relied on primarily on comparisons of GAD diagnosed individuals and non-anxious trials. In generalized anxiety, the amount of worry is more frequent, more extreme, and out of keeping with the threat that poses as an adverse event. People with anxiety report spending much more time every day worrying about uh, little things than non-clinical populations. They worry about the future even when things are going well. For example, worrying about the health of their children, even when they are not sick. They worry about their own future. What if they fall sick? Then they are not able to work. What will happen to their family? And this is when things are going very normally for them. The worry is highly pervasive, pronounced, and difficult to control, and frequently occurs without a precipitant. So they are not able to switch off these thoughts, constant worrying thoughts about themselves. The history of excessive worry has a longer duration, sometimes for months and years rather than hours or days. The worrying impacts on their patient's quality of life. It is distressing and disabling. As I've mentioned, it has those associated symptoms of muscle tension, impaired sleep, relationship difficulties, and reduced work productivity. So, understanding anxiety. Fear is an emotion we have in response to real or perceived threat, whereas anxiety is an anticipation of future threat. People experiencing an anxiety disorder find that their anxiety gets in the way of their normal routine in their daily lives and stops them from achieving their full potential, which then makes them even more anxious, and it becomes a vicious circle. Anxiety disorders are one of the most common in the mental health problems experienced by young adults. They are characterized by excessive fear and related difficulties that happen a lot of the time, feeling overwhelmed and interfering with their daily routines. Different situations and objects can cause different types of anxiety disorders. But the important thing is to remember that they can all be treated. And that's good news. What causes anxiety? So, not everyone comes with a generalized anxiety disorder, although everyone experiences some degree of stress at every point of their lives. So, what predisposes people to an anxiety disorder? There is definitely a genetic factor that has been linked to the development of anxiety disorders. It is said that 20% of first degree relatives have also suffered from the condition. It has been suggested that individuals may inherit the vulnerability to developing an anxiety disorder. So, if parents have experienced anxiety, their children are likely to suffer from anxiety. Psychological factors. A great deal depends on the lifestyle of the person, the type of stressors they have encountered, and their early learning. For example, if we were taught to fear certain neutral situations as a child, it can become difficult to extinguish that fear and these learned patterns of behavior as the child grows up. Therefore, we may have developed certain patterns of thinking and behaving which contribute to development of an anxiety disorder. An example I can give you in this point is in a child and adolescent who has been prevented by the parents or family from attempting swimming or say something more drastic like skydiving. They have always been taught that this is not a safe thing to do and better to keep away. So when they are exposed to this sort of a swimming challenge or these sort of activities in their adolescent and teenage years with their friends, they develop an anxiety and are not able to enjoy that. Whereas in children who have been exposed to this and been given an opportunity to do that, um, they are more less fearful of doing this. With some people, anxiety is linked to underlying health issues. Sometimes anxiety symptoms and signs are the first indications of a medical illness. And medical health problems that can be related to anxiety include heart disease, diabetes, thyroid problems such as hyperthyroidism, respiratory disorders such as asthma, drug misuse and withdrawal, particularly alcohol, withdrawal from alcohol and anti-anxiety medications and other medications can cause a rebound anxiety. Chronic pain and irritable bowels also can present as anxiety. So this is what a vicious circle of anxiety looks like. So when a person is anxious, there is increased scanning of them for danger, physical symptoms intensify, attention narrows and shifts to self. So when the person starts feeling more anxious, they try to escape or avoid the situation that has caused anxiety. This gives them a short-term relief, but causes increase in physical symptoms of anxiety, more worry, an increased use of safety behaviors in such situations, and then that accentuates the anxiety yet again. If we are able to reverse the vicious cycle of anxiety and break that cycle, what would that look like? So that would look like something like this. When we confront the fearful situation without the aid of safety behaviors, so without avoiding it, if someone confronts the situation that has caused anxiety in the first place, in the short term, there will be a slight increase in that anxiety. But if a person is able to sit with that anxiety, then they will notice a decrease in the physical symptoms that they have experienced. So the headaches, the palpitation, the heart racing will settle down after a little while. And they are able to use coping skills which they have learned to reduce the anxiety levels to a manageable level. And this reduction by using their coping skills gives them a greater ability to control their own responses and feel more confident that they are able to handle their own anxiety. What are the ways to reduce stress and anxiety? When the anxiety is at a peak, it would be...
Dr. Mitali, just before we take up this thing, I think I will launch a poll through this because in this current scenario, what we see that mental health has been enhanced with the level of stress. And the answer would be, of course, yes. So then which areas which concern all the participants over here? So which will be the most areas of concern which they are being affected by, particularly during this pandemic? I have launched a poll. So let us take a quick response.
Sure.
And I hope it will help us through in terms of taking the discussion forward.
True. So fear of losing the job, pressure of authorities, and agree that this has been a very common seen in over the past 9-10 months of the pandemic, given that there have been job cuts everywhere, the fear of losing job has been quite high. Work remaining 24/7, yeah, and stress at a personal level. I feel that many people have experienced that pressure as well, because everyone has been working from home, supervising children who are doing homeschooling. It is definitely stressful.
So I would request all the participants to quickly give their vote. Because yes, every front there is stress, but according to you, which one is the most which has bothered us? Because each of the factor, I would not say that if we look as a human being during this past 6 to 7 months, it has been everything, every scenario we have passed through.
Sure. I think fear of losing the job, and for some people, having lost their job and uh, experiencing financial stresses has been a really major challenge.
So
In the
another
population.
minutes, seconds more, then I will close the poll, and with
Yeah.
that, responses will move ahead. Okay, I see 99 participants over here, but as per my data shows, only 47 have responded.
Mm-hmm. Should we then 49? Yeah.
Okay, then, so on the basis of, there is no link, I have shared the poll. I think it would be available on your screen itself. So all
Yes.
of you can see this poll on the screen.
Looks like the fear of losing job and the pressure
It is
to
it is
higher
being a
expectations.
tie. It's a tie, in fact, with that.
Hmm.
I would take up. I will take up few questions in person from one to one once we are done with the PPT round. So this is the feedback. Okay, I'm launching the poll. So I'm ending the poll right now. Thank you for voting.
That's great to see. Pressure of expectations and fear of losing job.
So this is the result. I hope everybody can see the result. So pressure of the authorities to higher expectation, that has shown the highest amount of concern amongst all, followed by fear of losing the job, then stress at personal front, working remain there 24/7, and only 4% mentions pressure of publication. So with that, we'll continue with our further discussion. I hope that gives a idea about how stress has been very pertinent. It has been there, but particularly during this 9 to 10 months, how it has taken a quantum leap in terms of our health.
Absolutely, because the way we have been working has changed so dramatically over the last year. In every field, I presume, everyone has to have new techniques and new methods to cope with their work. Shall we continue?
Yeah, sure.
Then with ways to reduce stress. when it's a difficult time and everyone is feeling anxious and stressed, it is always wise to postpone any major life change, because decision making capacity at when you are stressed could be hampered at that point. Mm, sorry. Okay. The other important thing to do, as we were talking about, that personal stress on personal front has been one of the major issues over this pandemic. It is very important to resolve personal conflicts. Stress in personal relationships can be a major contributor to anxiety and depression as well. Learning how to communicate honestly and effectively with people and address the problems and conflicts that arise are very important. Sometimes just sitting and talking with the person, with the family, or in your relationship, talking out calmly about what has been the stressor helps ease the stress. Talking always helps. If you are not able to do that without getting anxious and agitated, then it is always good to seek help from friends, family, uh, if they can iron out things between in your relationship. But sometimes it is, most people are not comfortable in involving friends or family to help out in easing personal conflicts. At such points, maybe it is good to see a counselor or a psychologist who is independent and unbiased to help you work through your relationship problems. One of the most effective ways to reduce stress is to take your mind off your worries and make sure that you're spending enough time for enjoyable activities and hobbies. When you do get anxious and stressed, most people do not spend any time in doing the following their hobbies or in enjoyable activities which they have enjoyed in the past. They don't seem to find the time for that. But if you try to push yourself to restart those hobbies that you have enjoyed in the past, you will find yourself that these activities keep you engaged and your mind is automatically off the worry. The situation has not changed, but you are not worrying about it, because worries never help in easing the situation anyway. Control your workload. Work plays a big role in our lives, and as we have seen that there is a pressure over this pandemic period, but it is important to have a sustainable work-life balance, particularly now. I can't stress any more on the importance of regular exercise in managing stress and anxiety. As we have seen, the anxiety can cause headaches, palpitations, heart problems. So having an effective regular exercise by going for regular walks or attending to the gym or going for a run, walk around a park. You don't have to walk with someone because you're talking at that time. You can just listen to music and do your own exercise. The other forms of exercise that are really helpful in anxiety and um, stress is yoga. I cannot stress more about how much yoga helps with anxiety. Yoga is something that has started from India, and it has become a worldwide popular way of reducing stress and anxiety. Pilates, gym are other ways that you can work on and exercise. Apart from yoga and exercise, the role of meditation and mindfulness plays a very important role in this uh, management of anxiety and stress. With mindfulness, what I mean is focus on the task that you are doing at the time. And that way, your mind is totally devoted to that particular work that you are doing at the point of time. And so your mind is off the worrying thoughts. Even if it is a simple exercise of eating, if you focus on the food, thinking about the food, the texture, the taste, that even that will take your mind off from the anxious thoughts. After doing all this, you can always look to getting support for yourself, whether it is at work through a mentoring program or talking to friends, family. Get that support for yourself. And remember to relax. There are various ways of relaxation, listening to music, breathing techniques that you can find even on YouTube, or any psychologist can help you with teaching you the right ways to breathe to be able to overcome your anxiety. Yoga also has these breathing techniques as a part of the yoga schedule. Now, management of the anxiety disorders. There are two ways of managing anxiety. One is by cognitive behavior therapy, and which is the mainstay of anxiety management or stress management. And the second is medication. I will not go much into medication today, but focus on the mainstay, which is cognitive behavior therapy. CBT is considered the most effective therapy for anxiety and stress disorders. Effectively, you need about 10 to 12 sessions with a psychologist to learn CBT for anxiety. And subsequently, that can be done by yourself and does not need to be done with a psychologist after 12 sessions. The delivery of CBT can be done face-to-face, or in this pandemic time, people have been doing it digitally as well over Zoom. It is the mainstay of the treatment of anxiety. However, it depends on the severity. Sometimes when people are very anxious and have a high level of anxiety, it is important, they will not be able to actually participate in the cognitive behavior therapy until there is some calming down with medications. So at that point of time, they're given short-term medications to relieve their anxiety to an extent that they are able to participate in their own psychotherapy with CBT. It should be started as early as possible, and it is always good to have one-to-one psychotherapy with a psychologist, although sometimes group therapies also run. Personally, I feel at a later stage, a group therapy is important, because that way you can see how others are responding, what causes anxiety for others, and how they have been tackling their anxiety. There are other psychotherapy alternatives, relaxation, mindfulness, acceptance-based interventions, but the mainstay is cognitive behavior therapy. Now, these may not be as relevant, but I'd like to go through them. CBT has 3 stages. Stage 1 is when the psychologist educates you about your anxiety or what is causing the anxiety and the factors that are hindering your therapy. A part of the stage 1 is education about anxiety and uh, talking about the misuse of alcohol and drugs that can happen when one is anxious. In stage 2 is progressive muscle relaxation and breathing training, which improves the physical symptoms of anxiety and in a way reduces the cognitive symptoms as well. The cognitive strategies include learning to tolerate doubts and uncertainties, modifying your core negative beliefs and avoidance behaviors by using graded exposures. I can talk a bit more about that if you want me to at the end. Now, the final stage is aimed at relapse prevention so that if you have overcome anxiety at that point in the 12 sessions, how could you identify your early warning signs of getting anxious again and how to prevent that relapse of anxiety and future goal setting. So that is the end of my talk, and I have a couple of cases that I would like to do as a, maybe how do we go about this, Dr. Singh? Shall we break up participants into groups?
Can I turn them into a breakout room activity?
Yes, that
So,
would be good.
if
So
you can brief them the case. In the meantime, I'm dividing. I see 107 participants.
yeah,
So I can at least 10.
10 groups of 10. And what the task would be probably is to go through the listen to the case and then decide amongst yourself what questions you would like to ask a person, this patient or this person. If you are the first line of, if they have come to you as a friend or a mentor, what sort of questions would you ask them and what would you suggest to them to ease their anxiety? Okay.
Okay.
So here is
So before
Mr.
that,
HS.
before opening the room, if you can brief them about the case. After that,
Yes, I'm briefing them about the case now. So Mr. HS is a 42-year-old married man. He's a father of a 12-year-old son. He works as a taxi driver for the past 12 years since migrating to Australia. He has no previous history of any mental health issues, and there is no mental health or depression or anxiety in his family either. So he has elderly parents and a younger brother living in a remote village in India. And he migrated with his wife 12 years ago to Australia. 7 months ago, with the start of the COVID lockdown, his business declined. So he has been working as a taxi driver. So with lockdown, his taxi came to a standstill. He started becoming worried about his parents, and as he was unable to go back to India, started stressing about the finance because he has a mortgage here, he has vehicle loans for his taxi, he has a young son who is attending school. Plus, he was supporting his elderly parents financially in India. So that poses a lot of financial stress on him. So he began to worry all the time. He could not stop his worrying thoughts. He was scared about dying and thoughts of death and implications on his family. What if he got COVID? what if he died, and how is his family going to cope? And this he started experiencing headaches, weakness in his legs. He was unable to walk. Experienced a severe degree of nausea and diarrhea and appetite loss, and lost 20 kilos over a period of 3 months. So because of this rapid weight loss and diarrhea, he presented to the hospital several times and was investigated for all kinds of conditions that could lead to such rapid weight loss. He had endoscopies, MRIs, colonoscopies, and each time he went into hospital, he was checked out with all sorts of investigations, but nothing was found. He even had some allergy testing to see whether any of his food diet was causing this diarrhea and weight loss. Now, given his weakness in his legs, and he was unable to drive his taxi and started experiencing panic attacks and lost all confidence of being able to drive again. So this is my first case.
So I hope everybody have gone through this case once they got a brief idea. So what they need to do?
So probably what you need to do is ask yourselves of if this sort of a person or a work colleague came to you, what would you ask him? How would you offer him any help? What would you do?
I'm opening up the breakout rooms now. All those participants, they can join, and we'll continue this for 10 minutes. After
Yes.
that, we'll call everyone back. So I have randomly picked up in order to divide this group. So all of you can join the respective breakout rooms. Yeah, Professor Jemmy, you want to say something? Again, the activities, yes, if anyone can join. I'm seeing participants still there in the main room. Only few of them 50 of them have joined the rooms. Rest are here. Good afternoon, all of you. Sorry, good morning. Can you join the breakout rooms? You just need to click on the option join. So by joining, you can be there in your respective breakout rooms for discussion of the case. In breakout room number 3, the highest participants have joined. And rest of the breakout room, as well as in 10 and 9, all of them have joined. Professor Granaranjan Mohanty from breakout room number 9 is asking for help.
How do we do that?
So you have to enter, you have the access as a co-host? You can enter breakout room number 9. You can join.
Let me go. How do I go to the breakout room? Did I get more options? Let me see. Join breakout room number?
Room number 7.
I didn't get the question.
I don't have a question. Actually, nowadays, what is happening every time we are stressed due to the aspect of the schedule in which we need to deliver the lectures, we need to attend the meeting, we have to write a paper and whatnot. So, how to come out of that aspect in order, how to come out of stress in such situations? When you have to attend the meeting, also, you have to present a paper, also, you have to deliver a lecture at the same time.
Yeah. So, you cannot obviously be doing everything at the same time. So what you need to probably do is structure your day in that there is a time slot for all those things.
Right, ma'am.
And tackle it as per that structured routine to your day. Can you hear me?
Madam, the network is not so good enough.
Yeah.
The basic thing is, as you have said, that we should need to structure the dates. Undoubtedly, that is one of the good thing. But suppose all the aspects come down to you from the top, and you cannot reschedule it as per your own requirement. What should be done?
So at that stage, I think if you can talk to your senior management or whoever is your boss to plan out with them that this is what my day is and this is how much I can do at this point of time. Maybe I need to prioritize my tasks so that whether you need to fulfill that part of the job that you need to do as a priority, and what could come second or next could be delayed for a few days.
Sure.
So you could take some extra time. So talking it out with your seniors and your management might prove to have some solutions. So you can also discuss with them the challenges of working from home.
Madam, we are not working from home, we are working from the institute only.
Yeah.
We are forced to come down to institutes to deliver the lecture.
Right.
Because during this time of pandemic, we all are suffering in one way or the other. And
absolutely,
as you said, that we need to talk to the top level management in with respect to the schedules that we can do within a particular period of time. But suppose the schedule was being already given and all those are clashing at the same point of time.
Yeah. So clearly it is not working. The schedule that has been given is not working. for you to perform to the best of your ability, which is why then you will need to bring it back to your management or to your mentor or to your boss, saying that, look, we do have the schedule and we are trying to stick to this, but it is not happening. So for the best outcomes, we need to revisit this and see how we can change for a better outcome.
As such,
Because
I would
if
just
you
like
keep
to.
stressing out, it only makes things worse. Your productivity and your being able to deliver a lecture will become more difficult for you.
Very true. But as you see, just right now, I am having a lecture also. I have to attend this FDP also.
Yeah.
At
Being
the
a
same time,
coordinator,
point
that
of
is
time.
good. So we have to
Now,
take the lecture also, and everything is going parallelly.
that's what
Oh,
I'm saying.
that's very difficult, isn't it? Yeah. But what can
Because
we do about that? Worrying is not going to improve that, is it?
thanks
And
a lot.
on top of that, I will ask you to go for a walk to try and relax.
I can't. That is not possible.
Dr. Mitali, there is a SOS call from room number 5 and room number 2 also. So you can.
Okay, how do
Okay.
I?
Thanks a lot, Mitali madam.
Thank
Thanks a lot, Shikta madam.
Thank you so much, sir.
Yeah, now how do I get to that room? Leave room.
You have to leave this room and join room number 5 and 2.
Me,
No, Dr. Mitali.
acha, Mitali madam. Okay.
So in room number 5, there was a call.
Hi.
Room number 5 as well as room number 2. You can go one by one. I'd request all the participants to join to their respective breakout rooms, because the discussion is being carried out and our instructor is joining the rooms individually for. Yes, any help needed? Someone give a SOS call to this breakout room number. I hope all of you have understood what has to be done during this case. You have to come up with a solution as per the given case which was done. So once you come back to the original room, you as a team have to come up with a solution, that what kind of solution can you provide the case in order to overcome the problem. Was it clear?
Yes, ma'am.
Thank you. Thank you. Excuse me, sir. May I know AC711 the name, because again it is during attendance.
This is Ashish Kumar Panda, Assistant Professor of Commerce from FM Autonomous College. Balasur.
Thank you, sir. Thank you, sir. Sir, there is an option of renaming. If you can rename with your name, it will be easier for me to understand.
Okay, okay. Thank you, madam. Next time I will be signing in with my original name.
Yeah, yeah. Thank you, sir. Thank you. Professor Ashok Suryavanshi, are you here? So, if you can hear me, Professor Ashok Suryavanshi, you are in room number 5. So there would be a joining option given to you. So just make in the extreme right hand side. So just click on to join. So if you click on to that, you will be there in breakout room number 5. And as such, Dr. Mitali Das is also there in room number 5. They are having a small group discussion. So you can join room number 5 that is allotted to you. Am I clear? Thank you, sir. Thank you.
From time to time, it is because that
Yes.
trauma has not been dealt with and there has been no closure to that.
True.
So bringing out that trauma,
But ma'am, if the people
increases the
involved in
anxiety,
that,
but
yes, if
sorry?
the people involved in that episode are not
Yes.
willing to, closure for a closure, which is, which is perfectly suitable to both the parties. One person's closure is another person's trigger. So how do you
Yes.
cope with that? Yeah.
So you target one person, the person who is willing to seek help for that closure.
Okay.
And talk with him first for him to at least one person gets the closure, and then you talk to the other person for whom it has triggered and work through things separately, individually with him or her, for them to work through their closure.
Okay.
So
Okay, ma'am.
individually, it needs to be done individually.
And this needs a
aside from-
psychologist, not a psychiatrist, isn't it?
Can be for both.
Okay.
Yeah.
Okay.
Because sometimes because these situations do trigger excessive anxiety, some amount of medication is definitely warranted before they can indulge in that therapy.
Okay, ma'am. Thank you, ma'am. Thank you so much.
No problem.
Thank you, Dr. Das. There is another call from room number 9, so I came to just number 9. How actually we can trigger a short group discussion for the participants in room number 9.
Sorry, Dr. Singh, which room should I go to now?
Yeah,
or is it?
There is also a call from room number 6 as well as 9. Room number first 9 you can go, and then to 6. And in another 5 minutes, I'm closing the breakout room.
Okay.
Yeah. Hello, sir, I got a SOS call from this breakout room. Sir, I think the case which was given to you, you have to just look into those intricacies of the case and come up with a solution that exactly what kind of solution do you think should be given to the person in order to overcome from that respective disorder? Hello, Professor Tariq Inamdar. Dr. Mitali will be joining this breakout room in a short while. If you have any concerns, we are taking it in as a small group discussion. Then I will be taking you out from this room into the main room to come up with your point of views. Thank you.
Sorry,
Madam
Shikta, there was no response in room 6 or 9.
Okay. So I'm calling back to the original room and we will facilitate further from here. I'm ending the closing all those breakout rooms. And the
Okay, there's something from room 9. They've talked about some responses. Let me see.
So in another 50 seconds, all of us done will assemble into this main room. And after that, respective room wise, we can take up their viewpoints as far as the solution which they want to provide as per the given case.
Yeah.
I think the small group discussion will help further in order to have a better understanding. So that is the reason of taking out as a small group activity, even if it is in a virtual mode. Physically, it would have been rather more interesting, but this
Absolutely,
is how in some way in a virtual mode we can engage themselves.
True. And this is something this is something positive we've learned from the pandemic, I guess, to be able to link virtually.
Exactly. So now all the rooms are closed. So everybody have started coming back. So yes, Dr. Mitra, you might
Good
have
very good morning, ma'am.
I'm sure you might have some brilliant solution for the given case.
No, ma'am. We just tried. Good morning, everybody. Sikta ma'am and Mitali ma'am. Very good morning.
Good morning.
And a very nice session to learn about stress. And really, we are very stressful these days. And slowly we are coming out of it. And thank you, ma'am. I had a good team with Mr. Nautiyal and Mr. Umesh and Mr. Deepak Sapkal. We were 4 members.
Thank you, sir. Thank you.
And the
Again,
suggestion.
even ma'am Shikta ma'am also we are thankful, ma'am, because we such a nice session you organized. Even we got the exposure to get the empathy, sympathy, how to realize the strength, stress. These all things we understand, ma'am. Thank you, ma'am. Thank you.
Thank you so
That's
much.
true. And it's always important to remember that you are not alone in the stress. Everyone is going through some stress or the other.
So coming back, ma'am, can I go ahead, Umesh, if you're with your permission, and Mr. Nautiyal?
Right, sir. Please
Yes,
go ahead,
sir.
sir.
Okay.
Okay. So we had the team, Mr. Umesh and Mr. Nautiyal. We discussed the case study, ma'am, and we came about with some of the good points with Mr. Umesh
Yes.
also and Mr. Nautiyal. What I think, ma'am, that since both the family were divided into two locations, geolocations were different. One was placed in Australia and other part in India,
India.
and the person, Mr. H, has had to look after his family back in India. What I think, from my personal view, is that at some point of time, the social communication is going away from our society. The way we talk or we write, we don't write no more. It is monoblogging rather these days. But when we talk to each other, naturally our body language, our stress gets much more lowered when we speak out. वैसे भी
Absolutely.
इन इंडिया में हम लोग कहते हैं कि अगर कुछ दिल में दुख दर्द हो तो उसको बोल दो, तो बोलने से बहुत कुछ हल्का
Ah,
हो जाता है. तो आई थिंक देयर
absolutely.
वाज सम काइंड ऑफ communicate there kind he should have, Mr. HS should have shared his mental strength with his wife, and way back there is with younger brother, not with the old age parents, if the parents
Parents.
were
Yes.
age old. So if he would have shared this problem that he is going through, loss in business, he could have learned the inner potential of his wife, and how could
Yes.
his wife could collaborate him or support him in this pandemic, and together they could overcome the problem, because son was really very younger, 10 years of age. And way back in India, I hope
Yes.
that in India we have one of the habit of storing the resources. That means we save something. So in India, he could have just taken account of what in terms of resources they are holding, and how his younger brother could have supported his father, mother, and with the
Yes.
resources that they might be having. Naturally they might not be at zero position, and
Hmm.
finally add on to something by doing something with his skill that he might be possessing at that moment of time. In the meantime, my brother Umesh and Nautiyalji also shared that in the meantime he could have practiced little bit of meditation, so that his inner potential, he could learn what are the other inner potential apart from driving, that he can cash on. And finally he could have socialized somewhere with his friends in Australia, or somewhere with some social media thing, where he could have gathered information related to this stress releasing through some or the other way. There are many gurus there. Mr. Nautiyal shared about that he could have come contact with some gurus or some kind of spiritual people, those who can have given some ideas to ease down the stress. So this way he could have overcome his stressful journey that he was going through, the turmoil he was going through. But my point was most, I would just stress, communication had to be there between his wife and the brother way back in India. Thank you, ma'am. That was
Thank
my
you.
from my.
And yes, that was a very pertinent point, Mr. Mitra. And that is what he has done actually, and what we have encouraged to. So he did discuss with his wife. He was able to talk to his brother and his parents on, he used FaceTime to talk to them, and that was very relieving. His wife, in the meantime, did have a job, but he was feeling guilty about the fact that his wife is supporting him. And so it was very important for me to stress on the point that it is a relationship with a wife is a partnership. So while he has been supporting the family as a major financial uh, supporter for the family over the last few years, it is time for his wife to step in and take that burden while she has a job and she can support the family. He can take a setback and get himself better. So he was quite accepting of that in the few sessions that we had at that point. The other thing he did do, now Mr. HS
Can we
was
have
a sick man.
one more response from our group that what solution they came out with?
Yeah.
Before you give us the actual treatment which you have done, but if you can get it from our responses from
Let's
our
get it, let's get it from everyone else what they have
Dr.
suggested.
Shikha, if you can allow me, very good morning.
Sure, ma'am.
Yeah, Dr. Mitali, very good morning, ma'am, and thank you for such an informative and a very stress-releasing session. Though your case is very enterprising, and it can only come from a professional like you who is daily dealing with such situation. So I would bring first my team members who were a part of me in this discussion, Mr. Roshan, Dr. Selja, and Mr. Anurag. We all have thought in this exercise, and we got to know that first thing is that a man who has migrated from his own country and stepped out to a land which is a very different land to himself, he is a very brave heart, because taking a decision and coming out to a different country, it needs a lot of charismatic power, and that he has a support of his parents on his decision, and being attached to his parents, leaving a parent in India and coming to Australia itself was a very stressful decision. So he is a man who has already taken up stress in his life. He know how to cope up with that situation. So at this moment, my team has decided that when we are going to speak to him, we will just remind him about a sailor, a valiant he has been. So we have started our conversation with Mr. HS, saying that HS, you have been a fighter and an inspiration to many people. This is just a situation which has aroused, and this situation is called pandemic, because every next person is facing with some or the other situation. Next important thing, which my colleague, Mr. Deepak, has highlighted, we were also very close to this exercise, that communication, and being a faculty of communication, I believe the medium of communication is the connection to mind, soul, and body. So here from Australia, we are trying as friends to Mr. HS that first we have a build up a rapport and a communication to his wife, to his son, to himself itself, because family is a power. I don't believe the children should kept isolated. They are equal body in communication, because today the children, what they speak, and they bring sometimes such valuable advice, and they are the biggest power to motivation to parents. So this togetherness, where team stands for together everyone achieves more, we will only be giving him that power, the confidence, the resilience to bounce back. We have made sure that he speaks to his parent, and his brother is there, who is, and his parents have given such an upbringing to Mr. HS, which is the biggest booster to sail at the turbulent time. And here it is that we will hire Dr. Mitali to take a virtual advice to Mr. HS, who is going to bring his best stress and best situation out. So we have hired a consultant, and we have Dr. Mitali with us. So we will be taking a consultant's advice so that he can get the best remedy. That is my team's, takeaway on this case. Thank you, ma'am.
Excellent, Prof. Kavita. It's an excellent way you're dealing with it, and I can see how wonderful you will be as mentors.
Thank you, ma'am.
Given that you all are in the academic
yeah, it's a team
field,
effort, and Roshan and Dr. Selja and Anurag, we all were a part of this discussion, ma'am. Thank you so much for your encouragement.
Thank you. It is very important at this point to keep on reiterating about his resilience, because he is losing confidence. But you have shown him with your talk that he has taken up that challenge, come to a far off country. So he does have that resilience. He just needs to become more aware of it.
Do we have any other member to share their solutions?
I think from room 9, they have given a very nice suggestion too.
Yes, from anyone, if you can speak it out, it would be really Amal Bharadwaj, Professor Amal Bharadwaj, can you come up with your observations? I welcome you, Professor Amal. I just want to break that ice and people, they are.
Can talk it out.
Yeah.
Bharadwaj ji, boliye. They have mentioned that he should be told to do some light workout daily. And that's very important because he was experiencing weakness in his legs. So that is a very good suggestion. And the other one is that he should take this as an opportunity to spend quality time with his son and wife.
Okay, so we are closer to time. We can, yes, ma'am.
Go to the second.
Yeah.
Do you want to do the second case?
I don't think I will get time to do the second.
No? Okay.
It's already 11:30. We can wrap up with few more questions. So indeed, it was really, I think the breakout session was indeed great help to come up with.
Oh, it's 11:30, yes.
So how
because I'm in a different time zone, I'm forgetting. Okay. I will send you the second case and people can think about that because that was a very interesting case with a student. So it's important to know how to mentor.
Yes, sure. Yes, sure.
Ma'am, I would like to thank Professor Kavita Thapial, ma'am. She has a great communication skill. We would like sometime if she could mentor our communication skill, a great communication skill of one of our colleague in this team. Thank you, Miss Kavita, Professor Kavita Thapial.
Thank you, Deepak sir. You are indeed very encouraging, and I must say that the depth you have in your base is really remarkable. Thank you so much, sir. Thank you.
So yes, Dr. Mitali, if you want to say something, we can then.
No, I think it's time to wind up. It's been an excellent discussion, and I'm happy for if you have any, queries or questions, you can email them to me at any point of time, and I'm happy to provide any feedback if you need with regards to any of your students or your own mental health or stress. I'm more than happy to do that.
Ma'am, I just want to ask you that, we all talk about stress. That stress is there, a part of our life and everybody's life. But the moment we become stressed or we get the stressors, what as an expert you will advise we should do? What are the instant, things that we should keep in mind to cope up with that situation?
The first thing you need to do is the breathing exercises. And I can show you some of the breathing exercises here. Breathing and progressive muscle relaxation is the first step to deal with your day-to-day stress. So the progressive muscle relaxation, when you feel stressed, I'll speak for myself. When I feel stressed, I can feel that my back and shoulders hurt a lot. So for those sort of feelings, for headaches, what you need to do is the first thing you get up in the morning, you need to be able to clench your fists, your toes, and every joint to a point that it starts hurting you. Keep it like that until you feel the physical pain, and then slowly ease that out by releasing your fingers and your toes. You will find that that stress seems to be washing out of your body. If you keep repeating that with every muscle and joint of your body, it eases your stress to a level that it's unbelievable until you try it. So because I feel that stress on my back, I try to squeeze my shoulders together as if I'm holding a pencil without holding it with my hands on my shoulders. And then you feel that pain on your shoulders and back, then slowly ease that out. do this sort of an exercise 5 to 10 times first thing in the morning. I can send you some links to that.
Okay, ma'am. Yeah.
And the breathing exercises is, you can be doing a lecture, in between a lecture, you're sitting in your desk. You can do that anytime while you're driving. What you need to do is take a deep breath in, counting in your head to the time that you have filled up your lungs completely. You can't breathe any deeper. For me, that number is about 5. It might be 4 for you or 6 for you. Hold your breath and count again. Don't breathe out before counting another 6 or 5. What that is doing is it's giving your lungs enough time to supply oxygen to your brain. And then slowly breathe out, counting from 6 back to 0. Repeat that 10 times a day, 20 times a day. You will find yourself relaxing, because when we do become anxious or stressed, we tend to breathe very shallow, as a result of which we are not giving enough oxygen to the lungs, and the lungs is not able to supply enough oxygen to the rest of your body, particularly the brain. And if brain does not get enough oxygen, it becomes a vicious circle of anxiety. And you begin experiencing lightheadedness, headaches, feeling that your fingers and toes are tingling sensations. These all are relieved. The physical symptoms of anxiety will be relieved just with the breathing exercises. I do not have PPT, but I will send some brochures with these informations to Dr. Singh, and that can be shared.
Thank you, ma'am. Thank you. This is a great suggestion that you have given. And when I was holding my breath, I really felt that it makes some miracles. No?
It does. And when this becomes a habit, if you keep on doing, even when you're not stressed, if you do the breathing exercises, when you start feeling stressed, you will automatically start breathing like that. It comes with a lot of practice, but it's good to do every day. I think we are running out of time, Dr. Singh.
Yes, Dr. Mitali, I really, really appreciate the way you have engaged our entire participants. And in fact, out of all those stressful sessions, I think today's session, they might have felt a bit of relaxation, thereby forgetting and overcoming all their stress. Thank you so much for being with us and sharing your expertise with all our participants. Just, I wish to see you soon in physical mode when we come.
I wish. I'm longing to get back to India sometime this year at least.
Thank you so much.
Thank you very much, everyone. It's been a real pleasure. Thank you.
Thank you, ma'am. Thank you.
Bye-bye.
So we'll start right at 12 o'clock for the next session. We have with us Mr. Srimanta Panda, who is the General Manager of NALCO. It's a company, Maharashtra company, and he will be taking us through how the role of financial planning and information is important, not only that from the corporate, but also how for an organization, the financial knowledge is very, very essentially required to trim you, to work you as a complete leader. So thank you. Be with us. We can take a break now, and please join back again right before 12 o'clock. So a very good afternoon to one and all. Good afternoon, everyone. So welcome again to the day 4 of session 2 of this 5-day-long FDP program on the theme Leadership Genetics, Exerting Influence, Not Authority. So the second session is, we have our resource person with us, Mr. Srimanta Panda, who is the General Manager of Finance of Navratna Company Nalco. Mr. Srimant has been through in his financial position for a long career of more than 25 years, and he is rightly handling the trade financing, banking, treasury, as well as he handles capital structure, investment relationship, MIS, budget, also the direct taxation. He has done his MCom from Utkal University and MPhil from the Faculty of Commerce, Delhi School of Economics. And since his long career span with NALCO, he has been a very, very pertinent member in terms of bestowing his financial knowledge for generating more than $600 to $709 million a year and more than 15K fund flows and 20K to 6K investment in the company. Mr. Panda will be taking us through in today's session as far as how has the knowledge of financial implication of financial planning is essential, not only in an industry or a corporate, but also in the sphere of academic. So today we are going to learn from him that how we can use the sense of with his vast industrial practice. So I welcome Mr. Srimant Panda. Thank you so much, sir, for accepting our invitation. On behalf of KIT School of Management Directors, Dr. Saroj Mahapatra, and on behalf of the entire KIT University from our founder, Dr. Honorable Achyuta Samanta, sir, I welcome you all for this 5-day FTP program. Thank you so much, sir, for being with us. Thank you. Over to you.
Hello, am I audible?
Yes, sir.
Yeah, thanks, Professor Sikta. And I feel indeed privileged to be part of this deliberation and the exchange of idea and exchange of knowledge and exchange of information. And I'm humbled that I'm before a very esteemed participant, a group of participants drawn across the country, all in the field of mostly academics and maybe some also from the industry. I'm not very much aware of. Good afternoon, everybody. So should I start?
Yes, sir, you can. Yes.
Yeah. So then Professor Sikta approached me for this program. In fact, I was little edgy and I was on the back foot whether I'll be able to do a justice to this kind of program. I have never been before any student or any participant like this gathering. So I was little reluctant, but in the end, I accepted this offer, this invitation rather, to be part of this deliberation. Now the topic is like as diverse and as complex also, in the sense that if we segregate the topic into different packets, like its leadership in excellence, then the exerting influence without authority, then again coming financial skills, financial planning. So it was really, I was lost in the beginning how to interlink and how to establish a link, a flow between all these things. So that's why I was a little worried whether I will be able to do justice to this session and able to offer something. Still, I'm not sure, though I will try to make a best effort. Now, coming to leadership, I don't, oh my God. Yeah, sorry. I think all are from academics, from the field of OB or from the field of management, and they have gone through so much and they must have taught and read so much. So I don't have to tell them what is leadership. Just let me share my, give me a minute, please. Okay. it is. I'm not very conversant with this thing.
Sir, in the extreme bottom, a green color arrow mark. Yes, your screen has started. Or not.
Now, is it coming now on my PPT?
Just open the slide at the bottom. Yeah, it's done.
Yeah. So, I don't have to dwell much upon this. Why this is happening again and again? I think somewhere. 1 second.
So just cancel this Zoom launcher and that is a screen with the slide.
1 second, 1 second. Give me a second, please. I go to your share screen. Cloud meeting, Zoom meeting. Now, is it okay?
Yeah, it has started.
Yeah. So, coming to the leadership aspect, I don't think I am much in a position to offer anything, any new concept, new definition to all of you. But one line this I came across, which very much appealed to me, is what is the influence? What you are talking of is exerting influence without authority. That, according to John C. Maxwell, this true measurement of leadership is influence, nothing more and nothing less. Okay.
So sorry to interrupt. Can you please go for slideshow, just full screen.
1 second.
No, it's over. Just slideshow. Yeah.
Yeah.
Thank you. Thank you so much.
Okay. So, what is the true measurement of a leadership? It's its ability, somebody's ability to influence, nothing more and nothing less. That means a person, howsoever high position in an organization, in a setup, in a family, in a society he might be, but if he is not able to exert influence, he is not able to influence others, then his leadership is not that effective or efficient. Then coming to another nice piece I came across is you don't have to be a person of influence to be influential. In fact, most influential person in my life are probably not even aware of the things they have taught me. This is why Scott Adams, creator of Dilbert comic strip. What it implies, often we don't know what we possess, whether we have the power to influence, whether we are really in a position because of our personality, because of our knowledge, because of our character, because of our thought process, because of our ability to see the vision. We don't know whether we are really in a position to influence. In fact, we often get influenced by people also we never realize. So the influencing power of a leadership is often not realized, and we don't also realize through whom and by whom we have been influenced throughout our career, our lifespan, and that. Then another aspect of leadership and influence, which very much appealed to me, was by Ravin Sharma, the author. It says it's not a designation. It's about impact, the influence, and the inspiration. As I was talking a little bit earlier, and you almost all of you might have realized this also, all those who are working in an organization, working in an educational institution or anywhere, it is not the designation, although the designation matters. It is not that the designation doesn't matter, but still people are able to influence and inspire others. Then the leadership role pass on to them, passively, unknowingly. not in black and white, not in a hierarchical way, but they take the leadership role even if they are not in a particular position. Now, coming to next, where does this influencing start? Where does this influencing start? This influencing, according to me, it starts very early in the life. And all of you must have also realized it starts very early in the life, that is since our birth. We try to influence by crying, by throwing tantrum. It is by pressure tactics or something, and sometimes trying to be a goody-goody, very lovable and very adorable child. So somehow or other we try to influence, and we develop that trait gradually when we grow up, and the toolkit only expands. The toolkit what were available with us as a child, then as a teen, then as a adult, then as a responsible family person, and as an organization person, as a faculty member, it is the toolkit which only expands with different levels, different ladders. But the basic tenets of influence, it is always present with the individual. Now, what are the basic essentials of a person to influence, even if he is not in a position of power, position of any designation or any hierarchical structure? So as it is said, the 8 portals of character influence is to first to have character, then expertise, the domain knowledge and the specialized knowledge on a particular field, on a particular area, particular subject, matter of interest. Then character, of course, it is the integrity of the person, the honesty of the person, and his commitment for his words. These are the essential elements of a character. Then the correctedness. That means if I am as a person, suppose in an organization role, or as a faculty member, or in a society, or in a social setup, NGO, or any other field. So whatever information we are giving, whatever statement we are making, whatever objective goal we are setting, it must be with truthfulness. It must be correct. We should not try to be diabolical and try to mislead people. Then this social intelligence, how to relate with people, how to relate with peer group, how to relate with other members of the setup. Then it comes to network. It's not only important to have a character and to have your expertise in the field where you are working. It is also very important that you have to establish a network with other people within the same organization, among other departments. We have seen in the organization, a person, suppose in my finance department, a person who is extremely brilliant, a fine chartered accountant, and his knowledge, his analytical ability is excellent, but because of his, whether you call it inwardness or the not so upcoming or outreaching to others, so he is not able to establish a network with people. He is not in the other departments, whether material, whether production, whether marketing. So as a result, in critical time, he is not able to collect, collate information to present in, analyze and to present in a way which will help management in decision making. So as a result, he is a failure. He is a brilliant chap, but he is not able to network with different people in different activities. So it works for, I'm sure it must be working for your area of work, whether it is in social sector, whether it is in non-profit organization, or whether it is in an educational institution also. Then the last and most important aspect is the communication. I may be a very good leader in my area of work. You might be a very good professor in your area of work, and in a person or a project manager working in a social NGO or a others organization, but unless he is able to communicate what? Communicate the goal, communicate the objective, communicate the plan of action, communicate the measurement, the like milestones, where we are, assess yourself, then any course correction is required, and self-assessment. So all these things needs to be communicated and communicated in time with lot of corrected information. Then only a person will be able to be a great influencer, irrespective of his level, irrespective of his position. Then as I said, what is that required? You put it out there honestly, you think of what is the plan, what is the objective of the department, of the organization as a whole. It depends on the level of your organization. So these are the, it can be also at the family level. It can be also at the other non-profit form of organization. At family level, the father, the, you know, there might be a rickshaw puller, there might be a farmer, but his objective is to put his children in a good educational institution, give them a decent way of life, a urban life. So he must make it clear what he wants it to be, the vision, the mission. Then he must be honest also in his approach, which already I have discussed. Then you let it go, because everything is not in your control, but you have to be very transparent and put it across to all the participants, all the members. Okay, as we were discussing earlier, leadership and particularly this financial aspect of leadership. You see, it, as I discussed, as I was saying, it starts at individual level. It need not be necessary it has to be organization. These traits of leadership, it is beginning with a person at the family level first. In the family, either your father or your mother, or it can be both, they are the bread earner till we people are children. So they set the goal. The goal can be what? Education of the children, giving them a good lifestyle, having a house for your own, and then marriages of children, then retirement plan. All these are goals. Comes planning. Next stage. Like this goal is at individual level. So what somebody wants to aspire to. I am contented with having a house in my village. But somebody else in my age group, in my profession with the same level of income, might be he is more aspiring. He wants to have a house in a city like Bhubaneswar, or maybe in more or costlier city. So the goal, it can, like an individual, a parent, they set a goal for themselves, whether they want to send these children to the Navodaya Vidyalaya or the village school, or to some English medium public school, or to a technical institution, or a better place. Somebody wants them to send them abroad. So all this goal setting, like it is in individual level, it can be also in organization level. What the organization want to, where the organization want to go. Then it needs plan for that goal. What level of planning is required. These are all things which all you people are aware of. You might be teaching in more effective way, better way. But when it comes to financial leadership, it is no different than the normal goal planning, all these things of an organization or even at individual level. So having set a goal and having a plan at a short term and a medium term, at a long term level, then what becomes important is to have a budget. The budget is very important in the sense it translates everything, all the activity that we plan for the short term or medium term, into a measurable units, into a it is translated to a monetary unit. So budgeting is very important at personal level. Having plan is not important. We must plan the our budget, our monthly expenditure accordingly, food expenditure accordingly, our entertainment, our clothing, our other outings, everything. If we don't remain within the budget, 1 month, 2 month we see, and if we are overshooting our budget, monthly budget, then we have to make course correction. The same thing apply in the organization, nothing new. We prepare a budget, then we have to check every month, every quarter, then so that at the end, towards the end of the year, we are not caught on the wrong foot. Then as individually, we have a short-term, long-term, medium-term, long-term plan. So for that, for those goals, we need to have saving. And the saving at that level, the instrument only may change. Saving at individual instruments may change, but savings at organization level may change. But the same elements of saving is required for what? For bad days, for long-term planning. Then when you save, then an opportunity arises how to utilize that saving. What to do with that surplus fund, whether it is only to meet exigency or when it comes to applying that during the course of your journey of at individual level, buy a house, acquire a house, whether to have a flat, whether to have a land along with a flat, which might cost earlier, similarly at organization level. What to do, how to use that investment, that gives rise to a situation of capital allocation in organization level. At individual level, it is saving and utilization of that saving, which will lead to automatically capital allocation. So money management at personal and family level gives us a base. It is a precursor. It is a, I would say, a drawing board or a springboard to make us a real financial leader at a later stage of life. That I have seen. That it's just not theory. That I have seen in personal life also of people. So what we learn from personal financial management from our mother, from our father, from the elders or the head of the family, and when we grow up as a head of the family, the same thing, the same principle at a larger scale in a different landscape only, it get applied to organization, nothing else. Then as I've said, leadership, including financial leadership, is not a fixed point. It's not that the leadership shown at entry level of a financial person, of a management accountant, it doesn't stop or it doesn't start only at a GM or a ED or CFO level. It's a continuous process. That means the finance professional, a financial person in the field of finance, giving aid to an organization, acting as a supplementary role to the CEO or the board. So this process evolves over time. It is not a one-stop gap. It's not a only point of time. It has to be in continuous. It's continuously grow, only the complexity grows. Only the complexity, the tools, the toolkits available, the power, the quantum, the scope, only those things grow. Otherwise, it will be same. It has to be a continuum only. If somebody has not shown leadership style at an entry level, at a transaction level, at a reporting level, I doubt whether he can. I have seen people, those who have like they are hold back. They have not taken that lead even at a lower level. They have never succeeded at a high level. Never. That continuum is to be there. That means a person who started that leadership trait from a financial professional angle helping a leader or a leader even without a financial background, his acumen, his leaning towards financial learning is reflected from the day one, whether he is in marketing, whether he is in materials. He cannot incorporate these things just going to the top level, even if it is a HR personnel. So this has to be a continuum only. Like this is not new to people. We have a Maslow's what is this need hierarchy. This is also a financial need hierarchy. Okay, at the lowest level, it comes with entry level transacting. People only keep record, make entry, bank reconciliation, general vouchers, all that thing, record keeping, basically. Then at a little higher level, they grow up, they go to reporting level. Their figures are trusted upon. They have the ability to compile data, compile accounts, make a preparation of different statement and present. But then when you go to the higher level, it will come to like making forecast, making analysis, making planning, and performance monitoring, finding variance, like where the company or the organization is falling short of. So these things will be exposed to or required to on the part of a financial leader as he grows up. Then coming to the top, that is the self-actualization level, what we say in need hierarchy theory of Maslow. Then this typical and the very, sought after exotic level of financial is required, that is pricing, product positioning, then your merger and acquisition, fundraising, capital allocation, designing a capital structure. These are the things which will come at a little higher level. So for that, one must have gone through all these process. Unless somebody has just gone through these things, it will be very difficult to be successful at that level in organization setup. So coming to goal and planning and budgeting. Goal, as we know, it comes derived from our vision, mission statement of a corporate, at an organization. Then it has to be laid down to plan, maybe 5-year, 3-year, 1-year plan. Then it needs budgeting. Budgeting is nothing but, as I said earlier, translating all the activity of the organization into a monetary unit. And remember, it is important, it is for a definite period. A budget cannot be without a timeline. It has to be for a period. Generally, it is annual. So all the activity of the organization, that can be buying, selling, investing, or human resource, recruitment, training, advertisement, R&D, all kind of things, activities are translated into monetary items and a budget is prepared. So as I said, these activity, it can be operation budget, that is the day-to-day operation, production, procurement, sales, or it can be a capital budget, that is the investment decision. What diversification to be made, what plant to be acquired, which R&D initiative to be taken up, all these forms part of capital budget. Then the cash budget, how much cash flow will be coming, what the investments which will be maturing, what cash resource we have, and what are the outflow on a monthly basis, on a quarterly basis, on a yearly basis. There are some outflow which are yearly, like dividend. Now it has been made quarterly also, with interim dividend made compulsory by a lot of for companies, by the particularly PSUs like us. Then there will be like buybacks, or there will be opportunity which comes, you have to go for acquiring a business. That is why few of the companies, they keep a war chest of hundreds, thousands of crores. Even if whenever an opportunity arises, they will go for acquisition. You might have read few days back, Vedanta keep ready $10 billion war chest to only acquire PSUs in India. It can be in oil, it can be in metal, it can be in mining. Then another, this is a typical way of budgeting. And the budgeting, there are two other aspects. One is activity-based budgeting, and there is zero-based budgeting. Activity-based budgeting is one activity. Each individual activity is segregated and separated, and its cost is estimated. And if any revenue potential it is, or if it is only an intermediary thing, then that activity has to be estimated on its own. It is not that you just take manpower as a whole or maintenance cost as a whole. It has to be for each activity. Maintenance cost of each equipment, each plant, or as I said, like sales activity from each product, from each zone, from each location. What will be the sales realization possible? And for each month or quarter, depending on the product cycle, seasonal demands. Another aspect of budgeting is zero-based budgeting, where we generally start from scratch. In the other form of budgeting, most of the items are taken as a last year's achievement plus some percentage to take care of cost of inflation or to take care of some escalated demand from different units. But in zero-based budgeting, you start from scratch. Like, it's a very rigorous thing, and it may not be practicable in a complex organization to start zero-based budgeting for every activity. That takes a lot of time. That is a very complex thing. Then budgeting, once it is in place, this budgeting activity budgets are there and funds are allocated. Yes, going back to that cash budget, if there is a mismatch in cash flow, then the role arises. That has to be escalated higher ups, and the decision has to be taken what can be the source of funding, where from it will come, the shortfall, whether it will be borrowed, whether it is working capital, or whether it is some other little medium tenure financing is required, what source of financing will be required. So that cash budget is also very important. Operating budget, capital budget, then cash budget, which basically gives insight within a range of maybe 10% or so, what will be the cash flow, inflow and outflow, and what will be mismatch, whether the management has to take a call on how to go for funding. Then after all these things are put in place, what is there? It is only at the end of the quarter, or at the end of the half year, or at the end of the financial year. Ultimately, being a joint stock company, being a legal entity, you have to prepare your accounts. And the leader also needs to know, the owner also needs to know what is the status, where we stand, how far the organization has succeeded in progressing, in achieving its desired result. So all these things will give, can be interpreted, can be looked into from a financial statement. So any leader, they need to have this literacy. A CEO who is totally illiterate or totally not conversant with these things will find it difficult, often misled, often not comprehending the exact implication. So this financial statement can be a balance sheet, which is a snapshot on any particular point of time, and income statement, which is the activity reflection, like revenue and the expenses. It's the measurement of all the activity that has taken place. all the incomes and all the revenues and the expenses. Then the cash flow. The cash flow, as I said earlier, it is always with respect to a particular time frame it is done. Monthly cash flow, weekly cash flow, monthly, quarterly. Why it is important? Because at the end of the year, you might be having a surplus cash. At the end of the quarter, you might be having a surplus cash. But during the course of your journey, during the month, during the week, at some point of time, there is an immediate payout requirement. Advance tax payment requirement is there every quarter before the end of the quarter. 15 June, 15 September, 15 December, you use payment. So you don't have the cash at that time. The revenue, your revenue pattern may not be matching with that. The revenue, it is not that all industry, they have like your retail or your telecom or other industry utilities, they may not be having a revenue pattern of continuous every week, every day, every month flow. So when the orders are like suppose BHEL, heavy engineering industry or L&T, where the fund, the revenue out of sales comes in tranches in a time gap of 6 months or 1 year. So how do you plan these things? Immediate payout, monthly salary payout, procurement of material, advance tax payment. So all these mismatch, liquidity mismatch has to be balanced, and which is very important, very critical. Many companies has to buy dust because of this mismatch. Now, having these financial statements is not enough, because plain reading of financial statement may not provide enough indication of the health of the company, health of the organization. The leader will be the CEO, the board will be very happy, oh, we made this much of profit. But what is that? Does that profit imply your financial health is good? No. For that, lot of other analysis is required, which is the ratio analysis. It is a toolkit for doing, to decipher the financial statement, to know exactly the true health of the organization. So this can be in 3-4 different aspects. One is liquidity, another is profitability ratio. Liquidity says how efficiently you can meet your immediate obligation for payment to creditors, for tax payment, for dividend payment, for salary payment, all that. How much liquid you have? What is the turnover ratio of your debtors? How fast your sales is getting? If the sale is on credit, then how fast it is getting converted to cash. Otherwise, if cash is not there, your creditors may not be satisfied with again check or again longer credit. So that needs to be. There are two: current ratio and quick ratio. Current ratio includes the debtors also, the stock also, but it may not be possible always to convert the stock into cash. Instantly, if you go for a sale, then there is to a fire sale. There is to a, like you have to sell at a lower price. One peculiar situation I'll just give you in 2 minutes time. Recently with pandemic, all the lockdowns, particularly in our organization and many organizations, why we only? We had an investment of suppose 2,000 crore in different instruments, which are locked in for 1 year, for 3 months, for 6 months. If we exit before that, there will be some loss. And there is inventory. Yet we are not able to, organizations are not able to meet their commitment during the month of March end week, April, June, because after that, due to this lockdown, of course, you can say this is an extreme situation, but it happens. Financial year ending next first month of the month, hardly any activity. Many companies you will find hardly any sales activity, hardly any realization, hardly any revenue. That I myself have learned in 2012-13 very bitter way. We didn't plan accordingly. Maybe some senior people, they just went on because towards the end of the financial year, the FD rates, you know, it jacks up like anything because of the liquidity crunch at that time. I'm talking of early like 10, 2010, 12, 11, 13. So it gives you very attractive, very tempting investment opportunity. You go on investing. And you think, okay, next year in a month, my cash outflow is around 700 to 800 crores, and there will be inflow of around 6 to 700 crores. I will have maximum cash balance of 200 crores. I will manage, but it doesn't happen. In April, May, it is very difficult to get revenue because your marketing schemes, everything get finalized. There is a MOU mechanism, or there is a fresh arrangement has to be made with the. So all these things, suddenly what happens, it explodes. It becomes a very pressure tactics on management. Management phones started coming, complaints come to senior management, the CEO is involved, why customers are not paid, why creditors are not paid, why suppliers are not paid, because production line has to go on, raw material has to be brought in, people have to be paid salary. So this mismatch, what is the cash? That gives quick ratio. You remove the stock, finished stock. Sometimes you remove the debt if the credit cycle is little longer. Likewise, absolute profit is misleading. Absolute profit is misleading totally. You might have a profit of 500, 700 crores, but yet if you translate it to what is the relative, on what amount of investment, on what amount of capital employed, what amount of sales turnover, your organization has realized this profit, that will reveal the true picture of the profit. So solvency, I said, we can borrow to make immediate shortfall, but to what extent borrow? Then if you are planning for funding a expansion, funding a acquisition of another company, what will be the debt? It cannot be your own equity capital always, because equity capital is I don't know whether all of you are mostly must be aware, it is the most costliest form of capital. Debt is the most cost efficient capital. Why? Because of the tax relief on interest. Because I borrow 100 rupees, on that I pay 7 rupees interest. So the interest portion is deducted from my revenue, that is taken as a cost. So on that 7 rupees, 30% or 34%, 2.1 rupees tax I am saving. I am not giving tax. But if I am raising equity, that means owner's equity, owner's money only. So I will pay this 2% tax extra, and that cash outflow will be there. It will not be tax efficient, and when the business stabilizes, the owner will expect and require more return, because you have to reward the owners accordingly. Whether you reward through dividend, through flowing back, through acquisition, through buyback, but you have to reward the owners. So the debt equity ratio, solvency ratio is another important aspect. It's like interest coverage ratio, whether the organization particularly depends on the kind of industry. In utilities, in retail, in telecom, the interest coverage ratio can be good, because there the it need not be, what I'm trying to say, the borrowing amount and the interest for the duration, whether the company's operating profit will be sufficient to cover that interest payment. For that, there is another
Sir,
analysis taken out, that is called EBITDA analysis, earning before interest, tax, depreciation. Yeah, madam, somebody was saying something.
Sir, actually, you have written they fall into 4 main buckets. These ratios fall into 4 main buckets. But here we are discussing 5 type of ratios. So mainly we have to look into 5 types of ratios, or there are another 4 types?
No, this earning ratio is basically part of the profitability ratio. Okay. Earning ratio towards the end, 5 bucket, what I am showing, that is basically part of the profit. That is only extension. After net profit, you get earning per share. Okay. profit. That is only derivation of that.
Okay.
That only reflects the for the future investor what is the earning per share. But for the organization within the for the management, for the leader within the organization, these are the major issue. For CEO level, yes, for higher level, earning per share is a focus in here. But then there is a fallacy in that also that I will tell. Many organizations might be showing very good earning per share, but that is still misleading. Because the earning side might be on the right side, the revenue receipt side, there might be 1,000 crore revenue, out of which expenses got 800 crores of profit is, just I'm giving a broad gross idea. But that out of 800 crore revenue, the debtor itself might be around 250, 300 crores. So there is a hit on your cash flow. So when it comes to meeting your other obligation, paying dividend, rewarding the shareholder, or making an acquisition if an opportunity arises, your cash flow is not there. Or making interest servicing of your debt, your cash is not there. So that is why there is another concept called free cash flow. We are coming to that cash flow management. As we say, cash is the king for everybody. You know, a bird in hand is better than a goose. So it's like cash is the king. We measure the cash inflow both in terms of operating cash inflow, that is from operation, how much it is coming. Then there is another concept called free cash flow. Free cash flow is very important because when it comes to making dividend payment, making any acquisition, any leverage based flow, it is the or making any debt, free cash flow is the only thing which an investor, if an investor is interested to invest my company, he will not see what is the profit, what is the EPS, what is the earning per share. Earning per share is nothing but total earning divided by number of equity share. No, that is not sufficient. Whether the organization is having free cash flow, whether organization will be able to pay me dividend, whether the organization will be able to, the company will be able to service its interest cost. Those are the cardinal things. Those are the very stringent measurement that is to be seen, not the EPS. EPS is very misleading. EPS is very misleading. There are many corporates in history in even India, like companies showing EPS growth, robust EPS continuously for years, but within 2-3 years they have gone bust because of absence of free cash flow. Now, as I said, now you must be reading like .com bust.
Hello, ma'am.
Yeah.
Yes, doctor. You want to say something?
Can I carry on?
Yes, sir. You can continue.
Yeah. So this recently, you must be the startup is the new buzzword, isn't it? For last 8-10 years maybe. But everybody learn about the startup. How many company startups goes bust? How many startups they end up even within 1-2 years? There are reports, there are news you might be reading, people might be reading. And a survey by different agencies have shown the CEOs, the startup promoters, they have seen 29 to 30% of the failure is only because they have run out of cash. Only because they have run out of cash. So cash flow management is very important for any organization to survive. Then as I was telling, EBITDA analysis, earning before interest, tax, depreciation, because that is the real earning from my operation. That EBITDA will show me whether the organization is will be able to serve my interest. Any lender, any banker, they will see that. What is the EBITDA of the company? Whether they have sufficient interest coverage. Interest divided by EBITDA. If that is not sound, they will hold back from investing in your company, from lending to your company. because they know their cash flow situation is not good. The investment will be bad soon. So this is cash flow average. Another aspect of financial tool which is both very useful for a CEO and which the finance professional should handle it properly and which the outside investor also look at is the leverage. There are two aspects of leverage. One is operating leverage and one is financial leverage. What is the operating leverage? It is the total fixed cost proportion of the total operation cost. In companies like suppose us or any companies with heavy investment with plant and machinery and equipment, the operating leverage will be very high. But in even for telecom company, the operating leverage will be high because the investment in tower, in equipment, in switch gears, all those will be. But there will be like suppose utilities or retails. For them, the operating leverage is very low. What they need is only space. It can be hired, it can be taken on lease, and everything else is just flow. The working capital is blocked for this e-commerce company. They take only the floor area on rent and go down on rent. Everything else is just comes in and goes out. So their operating leverage is very low. So operating leverage being very high can be very costlier when a downturn comes for a company, particularly in manufacturing or asset-based company. And operating leverage occurs or it is inevitable when we go for products expansion scale. If a 1 million ton refinery is being set up by a petroleum company, and if they are expanding it to 3 million ton, 5 million ton, 10 million ton, accordingly they will go on expanding. But if something like, this pandemic happens for almost few months, the economic activity was stopped, people were off the road. So what do they do? Do they shut down the plant? Or for an industry like us, we are a metal producer. It is a process plant. The metal is aluminum is smelted from alumina at a particular level of heat, and that heat has to be power intensive in the industry. If the heat temperature comes down, the bath, that is called molten bath in the pot, will freeze and the pot will be destroyed, and it is huge investment to again redo the pot. So if there is a downturn because of the cycle of the market, the cycle of the industry, or because of the pandemic situation like this, and always all commodities have a cycle of 3 or 5 or 7 years. In 2013-14, we have seen the low price of LME. Our price is linked to the London Metal Exchange price. There it is around, it was $1,300, $1,200, and our operating cost was $1,800 or $1,600. What do? Can I shut down the pots? Then to restart the pots, it is time consuming, it is totally costly. So here the leverage will come into play. If the industry like this leverage will be high. If that is combined with a financial leverage, then it is a very risky proposition for investment. And the management, the CEO should be also very much alert. Never combine operating leverage with financial leverage. What is financial leverage? The proportion of debt, borrowed capital in your total capital. Whether you are going for investing, or whether acquiring plant, organic or expanding, or whatever you are doing, which is capital intensive, and you are not supported by sufficient equity, and you are mostly dependent on borrowed, and there is a sudden downswing. It can, if it is a seasonal downswing, you can, this operating leverage, financial leverage can be tolerated. You can tide over it. But if it is not a seasonal downswing, it is due to some other structural problem, then it will be very disastrous to have a operating leverage and financial leverage in an organization simultaneously. And it is the important duty of a financial manager or a CEO, CFO to guard the management. No, you cannot borrow to this extent. It will send a very wrong signal to the investor, and really the company will be in a soup. Now, to this leverage is, however, desirable. The leverage is desirable. Why? Financial leverage particularly, because as I said earlier, equity is the most costliest form of capital, and the borrowing debt is the most cost efficient form of capital. So if you want to use the most less costly capital, we have to leverage. Unfortunately, for an organization like us, we are having a zero debt status for last 15-16 years. It's not a desirable thing. Our owner is who? Government of India. They say, no, you are not utilizing. Just 3 days back, we had a meeting with the Department of who looks after disinvestment and privatization. So from Finance Ministry arm, they say you are not utilizing your leverage. But our counter argument was, I cannot utilize leverage or borrow just for the sake of borrowing. My investment opportunity must come up. What are the hurdles? Those are different aspects of the story. So to use leverage in the short term also can be a very useful financial tool. There is Excel sheet. If I open a bit, it might take a little time what I'm trying to say. Now, towards the end of the March, we had almost around fund of 200 crores, and which was depleted by the 5th or 6th of April. And up till that, by that time, all our domestic sales were frozen because of the continuous lockdown. Export sales, whatever has happened, we're not able to realize money because even all banking transactions were bought. Banks branches were not opening. Couriers were not coming. Documents were not able to get from Vizag port, Calcutta port. So there was a crisis in the company how to finance next month's expenses of around 700-600 crores. Then our production guy, the director of production, he feels stocks are accumulating. There is no place to keep stock. That marketing not able to sell. They are saying the sale is not happening because customers are demanding heavy discount. They are saying you offer, suppose on a sale of 1,40,000 rupees per metric ton, they are saying you give us a cash discount of 20,000. Impossible. Our margin is not that level. Then we were there at finance professional. I was there. We told we don't need to cut down production. You produce full swing. Full swing, you stock material wherever it is. Whatever concrete floor, aluminum being a weighty material, you keep it wherever in our smelter plant, ideal floor, or you bring it to Bhubaneswar. Keep in our office premise, on a road, on within our colony, whenever there is a Pakka pitch road, stock it as much as possible. Then where from the fund will come? How will activity go on? Then our solution is there. We will borrow. Borrow at what? We will not borrow at rupee. We will borrow it in foreign currency. We will borrow it. There is a window available to us that is called PCFC, Post Credit Facility, Exporter Facility. There I will borrow at LIBOR. LIBOR is London Interbank Offer Rate, which was at that time ruling for 3 months around 0.97 or something like that. And we borrow at that level with a markup of around 10 basis points. That means we borrowed around $50 million, that is translating to around more than 370, 380 crores at a net rate of 0.097 per annum. And we borrowed at an exchange rate of 75.50, 75.53 like that. And somehow being in the market, this is the role of a finance professional with a deep understanding of the market, where things can go. In the month of April when I'm borrowing, we have seen the worst of pandemic, not here in India, in Europe or in America, but in China. There by 4th week of April, China's 95% production capacity has come up. That means demand is going to come up in a month or two in China, definitely, metal demand, commodity demand. If China is active and commodity is active and China demand is coming up, then definitely this price will recover. So why should I make a fire sale at $1,450 of LME when the customer is demanding 20,000 discount in domestic market, and in international market I will sell at 1450. But let us produce and stock, and I will finance your operation for 1 month or 2 months. and I will borrow it. And we did that exactly. We borrowed at 74.50. And as the economy look up, we had a feeling, I had a feeling, because we are in the market in the midst of thick of things. We knew the rupee, which was depreciating to 76.80, will definitely come back, will gradually recover. And that's what happened. We borrowed at 75.50, 75.60, 75.70. We could not still borrow at 75.80 because it took time to convince our management. Then by the time after 1-2 months, when we paid back at 74.30, 74.80. So there is a net gain of foreign exchange gain of around 2.7 crores we made, and interest notional saving was also there, because what we did, there was another option of borrowing in rupee. Borrowing in rupee at what cost? It might be 7.5, it might be 8% rupee loan, rupee credit loan. But when I know I have a definite export receivable, and when we have a deep understanding rupee is going to make some recovery from here, so we made a deal out of it. We saved interest, we saved on foreign exchange gain from exchange variation gain, and we finance our operation. All the creditors, all the suppliers were paid in time, not a single day delay. We used to give 15 days report every month to Government of India. Not a single day delay will be tolerated. So that is where the role of a finance person comes, aiding the management in making decision, making the operation of the company at least cost, keeping an eye on the future where I can maximize. And as a result of that, our push to produce, we had an inventory of 50,000, which was highest in the history for last maybe 18-20 years. People were aghast, what this guy are doing. But we made a gradual sale, but we made a sale up to December. Even in December also our stock has come to level of maybe 17,000-18,000. And you know, by the time what LME has recovered to, now it is 12,000 plus. From $1,450 per metric ton to it is now $2,000 per metric ton. Around $550 per metric ton multiply with 73 per metric ton gain. What is it? More than 200 crore gain will give to company because of this. So that is where leverage is to be used strategically in a place where it gives as a tool in the hands of management to continue operation, and at the same time use borrowed capital for the betterment of the company. I think I'm taking a little more time. I'll speed up because initially I thought I will finish it a little early so that Professor Sikta Singh can take a session, because I was asking her whether how come she is not there, she is not taking any session. So she was saying she has prepared something, but she doesn't have a slot. Then I told her I will just end up early, and moreover moreover that my CEO, CMD had called for a meeting at 10:30. I joined that and I told them that I will come back by 1:15. So then there is another tool which is required is project evaluation for investment decision, for purchase of equipment, capital. For that we make this tool use what is a net present value and what is internal rate of return. Net present value is the cash outflow at present for acquiring that business or that equipment or that plant, and the future inflow of cashes. So at what time all those will balance out. And another is internal rate of return. What is the deficient there in NPV? It doesn't take into account the return on the cash flow which will come at period 1, period 2, period 3 like that. But in IRR that is also accounted for. That little it involves a little bit of calculation, not scope of this deliberation. But these are the tools used by finance professional, finance guy to help management which project to go for. Any investment decision, suppose our company also, anybody goes for any downstream, any diversification, any setting up new unit at different place. So what is the NPV, what is the IRR? These are the two words you must hear. to assess any investment decision and make a right kind of trade. Then nowadays you people are like more into this, you must be more literate and learn about these things. This is not our forte, but still this financial forecasting and analytic forecasting we do use on a Excel based model for 1 year, for 6 months, for 2 years, even recently for 5 years also. We make simulation to say, yeah, the one interesting thing just I'll tell in a nutshell. Recently, last 2019 September, Government of India, I think, announced the reduction in new tax, dual tax regime. One can switch over to earlier, it was 30% plus for corporates, for Indian corporates. Like last year, it was given to individual. It can give 30% plus your education sales surcharge, whatever is, and alternatively, you can switch over to the new tax regime, which is 12% and 22% over which surcharge and so effective rate is 25.17. Now our management was bothering. Auditors were asking CAG, we being a government company, why the company, what is the decision? When the company management is also in the dark. So what we did recently, we made a forecast of 5 year, 8 year, 10 year up to 2036. Now how, like I'm not a God, I am not a professor, I cannot forecast price, expenses, what will be there 5 years down the line, 8 years down the line. So we simulated a situation like all kind of possible, best possible scenario, worst possible scenario. What can be the, I forgot, we didn't focus on price or cost of material. Ultimately, what is to go for tax planning, what will be the PBT? In the new tax regime, what is given, you have to forego certain benefits and exemption. Government of India's objective is to abolish the benefits and exemption and reduce the tax rate, which is there abroad in most of the country. So we removed our, we didn't focus or waste time on these things like product price or potential market or raw material input price, all that. What we do, we simply assume different levels of PBT. And with different levels of PBT, what will happen if I go for new tax rate, we'll forgo some of the benefit. One of the very important benefit in that is additional depreciation. Going a little technical, may not be of interest to all you. Additional depreciation is after 2004-5, whenever a company invests any additional plant and equipment in any financial year, on that year they will be eligible to get 20% additional depreciation. Ultimately, over the life of the plant and equipment, 95-100% additional depreciation a company will get. But here, additional depreciation will give 20% in the first year itself, in addition to normal depreciation. So it is a cash flow mismatch. That means with additional depreciation, initial benefits will derive from government, cash flow. Our tax outflow will be reduced. Now that was a challenge for us to. So we had to make a around 15, 16 year estimate and simulate, and we showed it to our management in all kind of possible and in all kind of optimistic and pessimistic scenario. This going to the new tax regime of 25.17% will be hugely beneficial for the company. Till for last 1.5 years, our management was not able to take a call. I started looking after this in November. Then we made this estimate and we made a simulation. We presented our tax consultant also. They agreed in this is a win-win situation. We should go for it. Otherwise, earlier everybody will say, if you go for this, your capex is coming up. We have a capital expenses of 6,500 crore, where the new plant will be commissioned from 2013, 23-24. So what will happen to additional depreciation? We will forgo that. Then there is we have a wind power. We have wind plants of around more than 250 megawatt in different places, 5-6 places. So there also that is called ATI benefit in income tax. If we go for new tax regime, we have to forgo that. We have to forgo the accelerated depreciation on this thing, scientific investment also for the R&D. We took into account the worst possible scenario for all those things. Still, we proved it will be a win-win situation. So this is where the financial forecasting comes into play, to take a crucial decision with a long-term implication and assuming the with a simulation, maybe Excel based or maybe some other tools with some analytics. This analytics is another area where people are talking a lot. People are using this jargon, this term very loosely without knowing what it is. We don't know also how it can be used in a manufacturing organization like us. I am told, suppose I have a requirement of raw material of caustic soda or aluminum fluoride or CPCO. Now, analytics can be used to that extent. Well, we have a procurement from 7-8 different places. Then we use those different sources, and our productivity, our efficiency, our parameter current, how it fluctuates with those sources. These analytics will give us, educate us, and help us to make better decisions. In this, lot of data is required, so advanced machine learning is required. This is a new area of activity for which we are not yet that much, but many companies are doing. Particularly this IoT-based companies, internet-based company, and consumer behavior, they are doing it very much. But in manufacturing, still it is to take up. Then there is another aspect, financial engineering. Financial engineering, it is a multidisciplinary approach. It includes the theories and the science of computer, mathematics, economics model, and with finance. Okay, so this is a very advanced and exotic area of financial world. And people blame it for the 2080 debacle, but still I will say it is not that. If it is regulatory frameworks are there and if people use it with prudence, financial engineering is a real edge in the tool in the hands of a leader, a CEO, a management to enhance the cutting edge. Financial engineering, there can be in different area with equity, non-voting shares, differential voting rights, sweet equity, employee stock option, putable. Recently, Vedanta tried a financial engineering. You people must be knowing Vedanta made an offer for buyback, but it failed. What was their intention? Their intention was to make 90% of the buyback, so that once it goes below 10%, it will be delisted. And once they are delisted, they will be freed from lot of obligation of the SEBI and other things. So they can siphon off their Indian units are, very cash rich, cash generating units. The Vedantas can then Vedanta, Jharsuguda, Sterlite, all these are very much cash rich company. So Vedanta being, they have been using their financial muscle, mobilizing billions of dollars of funds internationally. They wanted these Indian funds to refinance some of their old existing debt, which was at a little higher cost. Now you must be knowing in Euribor is at negative rate. So they wanted to refinance their existing costly debt first, then make this. So they were making that attempt, but it did fail. So sweat equity must be knowing the controversy between Mukesh Ambani and Ambani because of the Mukesh Ambani given that 12% sweat equity. Sweat equity is given for managerial expertise, for a goodwill, for a brand name like that. These are the financial engineering. Differential voting right can come with less voting power but higher dividend. Non-voting share. I will subscribe, I will give capital, but I will not have vote. I am not interested in the matters of policy decision of TCS, in policy decision of Infosys or any other company. I'm least bothered. I'm only interested for my dividend. So give me non-voting share. So for that, many companies also resort to non-voting share. Then putable common stock is also there. Intel used once. Putable common stock is then like the equity holder will have the right to offer it rather than the company asking for buyback. Generally, when the capital is reduced, the company will go for buyback. But here the investor will have the option, the equity holder will have the option to put it. In debt also there can be financial. All these are because the zero debt So that means it is issued at a discount price and it comes with zero interest, zero coupon bond. Like it is also called deep discount bond. Suppose 8% 100 rupees bond. That means on 100 rupees 8% interest. But if it is a zero coupon bond, it will be issued at 97 or 98 or whatever pricing is decided, and it will be redeemed at par to the investor after 5 year or 7 year at 100 rupees, but they will be not served any interest. So that means only the capital appreciation will be there. Similarly, dual currency bond, it can be in two currency, one component in INR, one component in euro or dollar. Then floating rate bond, where the bond interest rate coupon rate is linked to a particular benchmark. It can be LIBOR, it can be your treasury bill rate, it can be your GSEC rate in Indian context. So that as and when those rates moves with the up and down of the economy, then these rates will move. Like these instruments are used in mutual fund also, then dual rate loan also will be there. So I'm little fastening up. I think I took a little more time. And then hybrid instrument, it is convertible debenture, which Reliance issued initially in 2000 triple conversion. There are other company which issue convertible debentures. We had also issued once. Equity linked debenture. Why all these are? These are the instrument required for the management, for the owner wants, he doesn't want to lose control. At the same time, he wants finance, he wants resource to be raised for funding expansion, for acquiring business. So this is where the finance leaders, CFOs question, because these kind of decisions are generally involved at the highest level of financial leadership. They implement, supplement the management with these tools, which are the equipment that can be taken. Then in financial engineering, these things you might be reading in business schools also, in foreign exchange, in equities, forward, futures, options, swaps, FRAs, other things. These are highly sophisticated tool. Forward is a little simple, but if it comes to options, gigs, calculating, these are the tools to mitigate adverse reaction, adverse market movement in foreign currency, in commodities. It happens in commodity, it happens in oil, it happens in metal, it happens in copper, it happens in bullion, it happens in our own industry, and it happens very much in currency. The foreign exchange market world over in derivatives is much more larger than the spot market. So different mutual fund also they structure these schemes like hybrid scheme, like sector specific schemes, equity link schemes. All this with the help of financial engineering. So here these tools, these are the toolkits which are the real in the hands of the generation next, who will play a major role, like financing a startup, seed funding, level 1 seed funding, level 2 seed funding. For these things, what kind of equity, what kind of debt to be issued? This is where the generation next plays a major role, because the old school of finance people, they don't have much control, command over these things, or learning ability, skill set for these things. And these skills are also looked by leaders in younger generation. Even if they are not finance, they hire a finance professional, they look for these kind of tools. So these tools have a very relevant and very, these are the in things now. This is a small example I wanted to give, but it may take time. There are two companies, A and B, one in petroleum sector. One wanted to acquire A, or wanted to acquire B, but the difference is only in terms of the future crude price. What will be the future crude price? A wants to acquire B. Okay, so B feels future crude price will be very rosy, very high, so I deserve a better price. But A feels, no, future crude price will be very low, very pessimistic, and crude cycle has been like this. There will be oil shock and all that, or something. Glut will be there. The oil has come up in US, which is a fact, which is flooding the market, prices has gone down, so you have to come down the price. Then they we discussed and agreed with the help of financial engineering. What is that? Then they arrive at a level where they fix two levels. If the crude price goes beyond that level, then A having acquired B, if the crude price goes beyond that level, will pay B periodically for some years to compensate for their opportunity loss. And in turn, if the crude price go below that, then A having acquired B and fuel price having gone below that, that means their revenue potential has gone down. So B will compensate B for certain years with some flow in a year. It's a very interesting model. It happens in many commodities. And this is where this financial engineering comes into role. At what level and what price? What are the factors that will determine? And then the most important aspect and at the highest level of actualization of a financial leader is the capital allocation toolkit. Now, capital is there. We have resource either from internal accrual, saving. This can be three alternative reserves for raising capital. Internal accrual, issuing debt, raising equity. Internal accrual from operation, you are saving, profit is there. Dividend is a non-cash item. There are some other non-cash items. So there is cash accrual. You are saving, free cash flow is there. You are having a war chest. You can acquire business. You can expand. Or you have a good opportunity to acquire a business and you can issue a debt. You can issue debt. You can raise equity. Now these are the three sources through which you can raise capital. But then how to allocate that capital? Nobody is give dividend by raising equity or raising debt, issuing debt. But if you have a internal accrual, reserve and surplus, then dividend expectation of shareholders is a must. You have to reward them. Otherwise, your stock price will not be reflected. But it is not necessarily if you are paying dividend, your stock price will skyrocket. It never happens because there are lot of other factors which come into play. So paying dividend, investing in existing operation and expanding, acquiring other business. Okay, it's inorganic growth. The investing in existing operation or expanding or diversifying is organic growth. Then paying down debt. You have a debt which is costly, or even if it is cost efficient, still the debt were taken at high level, 9%, 10% level. Now I have resource. Now funds are available at much cheaper, 5, 6, 7% level. And I have a accrual, so I must pay back. Okay. So these are then the last one is repurchase, buyback. It's the most potential tool in the hands of a CFO or a CIO, which can be used to reward the shareholder, the stakeholders handsomely over years. There is a study, I will tell the name of the books, what it is called, The Outsiders by William Thorndike. It's demonstrate how leaders. Now, if you are asked to name a leader of 21st century, great leader, not political leader or any religious leader, spiritual leader, business leader. What are the names that will come? Jack Welch, that is one of the names which will come foremost to anybody's mind. People General Electric, he led 20 years, from 82 to 2001, 2002. And he was a visionary leader, it is told. He gave concept like Six Sigma, he gave concept like TQM, so many things. He was roving, he was going to all operating unit, interacting with the people, having giving more than twice, thrice profit than what the return would have come from investing in S&P 500 at that time. During those periods, for any investor, if he might have invested $1 in S&P 500 stock, that might have given him whatever amount, but Jack Welch's return was much more than that. Yet, was he a most successful leader?
It is Ratan Tata, the business leader.
Okay, coming to that, I'll come to that again. A study analysis by Harvard School shows there are at least around 10 other business leaders. There are around 10 other business leaders, very little known, not known to outside world. You may not have heard their name anyway. They have given much more better return, much more higher return than what Jack Welch has given to the shareholders, to the stakeholders. So whom do you call a successful return in terms? There can be different aspects, as the gentleman Rao said, Ratan Tata, showing philanthropy, showing visiting an ex-employee is a one yardstick of single leaderships.
थांब जरा आता संपत आहे माझं लेक्चर.
Pardon? Pardon? Hello?
Yes, sir.
But if you see the kind of decisions, Chorus acquisition, that steel acquisition in India, which led to...
Sir, I would like to tell something.
Yeah,
that see, any company, any organization that has the fate of only 30, 40, maximum 40, 50 years, but it is only the Tata group of companies which is existing in India for the last 150 years. Hats off to them. I'm telling you an example. Sir, just let me complete. I was in US in 2017. Yes, I'm very senior professor at BIT Sindri, Professor G. Kumar. So there I could see the Tesla car, the driverless car, and the battery, it is battery operated, fully battery operated, automatic. And once the battery is charged, it can cover a distance of 500 miles, means 800 kilometers. And at all fuel pump, the charging facility is there. So it was offered to Ratan Tata to start this project, making of the battery at US itself. But he declined that offer. He told, I'm ready to supply the battery to the company at a lower cost, much lower cost, but the factory will be at India. I'll establish the factory in India. So he did that. So in my opinion, he is the greatest business leader. Of course, sir, Bill Gates, Warren Buffett, all those persons are there. Steve Jobs, and then Alibaba's group, what is that name? Jack Ma, they are there. But in my opinion, Ratan Tata is at the top. Because pulling a company for 150 years, that is not a joke. You name any company, you name. That's our life is hardly 30, 40 years, not more than that. So hats off to the Tata group.
Okay, sir. Can I say, so that is, sir, one side of the story. The Palonji Mistri controversy you have also seen. The Chorus acquisition you have also seen. The going bust of nano car you have also seen. So there is another side of the story as well. We know Ratan Tata is a great philanthropy, great leader. We don't deny that. But what I am saying is the 21st century's US leadership on which the study was taken, who among Jack Welch, nobody can deny, in 21st century, Jack was the greatest, tallest leader of entire US. After that, leaders like Steve Jobs or Zuckerberg, they have come up. But there are companies, there are small unknown companies like Teledyne. Its founder was Henry Singleton. He was an MIT mathematics professor. He gave up some of the concept during World War II, which is still in vogue, like inertial navigation. He was not a finance guy. Then there are many other leaders. Catherine Graham of Washington Post, John Malone of Fast Moving Stream. Then there are 9 names. Why I was telling, not in the context of general, the way they made capital allocation, that makes them greatest leader. The focus on free cash flow, the focus on capital buyback, they never paid dividend. You see, sir, can you imagine a company of Teledyne, you take down the name Henry Singleton Teledyne, for 28 years he ruled the company, he never gave a single dividend payout. Yet he gave a return which was 13 times higher than the S&P 500 return and which was multiple times higher than what even General Electric gave it to its shareholder. So I am purely talking from a financial perspective, as a financial aid to a CEO, how to reward a shareholder. Then after that, a CEO has the fund owner. Now this there is another combination of you might have heard also eBay owner Omidire Foundation. They combine the philanthropy arm along with the their commercial operation. Only they had to forego is some tax benefit for not being a 503 company. So my emphasis here was the financial leadership and a CEO who is not even a financial leader, who is not a finance background, who is a scientist, who is a mathematician, who is one of them is a lady also, a widow. How they have maximized wealth by this tool of capital allocation. What to do with your capital? Award the shareholder with regular dividend payment, or go for acquisition, or even sometimes just sit idle, do nothing, and buy your own stock, own share when the prices are very low, and have a more control over the company. And when the operation again gets going, when the economy or the industry or the sector goes up, then again raise fund, go for expansion, raise fund. That is the tool. That is the tool in the hands of a financial leader. So as I was saying earlier, it is a continuous framework. Financial leadership is a continuous framework. It is not at a particular level. At entry level, one can be
can we take a few questions? Already we have questions, so there are certain raise hand option. Professor Ashish Kumar.
Before that, I'll just take 1 minute. Before that, just this financial leadership is not only confined to commercial entity, organization. It is equally applicable to, as I told earlier, non-profit sector, your educational institution. Suppose Professor Sikta Singh wants to start a course for an idea to case of management. She wants to start a MBA or a diploma in particular field. Then obviously the finance guy, whoever is aiding the management, the owner, the funder, they have to sit down. What is the revenue that will come in? What is the direct cost? And what is the overhead cost that will be there? What is the common thing that already we can leverage upon? So there will be spread of overhead. Without that, nothing can be done. Similarly, for any NGO, any social sector to take up a project in any remote area, they have to, what do they depend for revenue? For their donor, for their funder, funding agency? They have to see what do they can make a different financial projection, financial statement for their funding agency, but they have to have their own financial statement to see where do these things time, where they will run out of steam mid-course, even before completing the project. So this financial, this leader in this sector, whether it is an NGO, whether it is a educational institution, head of a NGO, or even a political party for that, need to have this ability to decipher, to see, to have the clear picture, big picture, so that the organization can survive, and organization can thrive, and organization can be successful. Thanks.
Thank you so much, indeed, Mr.
Yeah, I promised something, but I couldn't complete it.
No, it was so really engaging and full of information, loaded with information, and I hope all our participants, those who are present over here, have really gained in terms of their financial.
This is a slide which shows how people, like some of the startup has gone bust only because of finance. Recently, 2019, 2020.
So if any questions?
I think I overtook my time, so people have lost.
Hello.
Yes, sir.
Yeah.
Sir, at the outset, I will want to thank you, sir. I am Ashish Kumar Panda from FM Autonomous College, Balasur. Sir, here you told that equity and debt capital. Equity is the costliest form of capital, and debt is the cheapest form. You have cited one of the part, that is the tax part. But I think the risk associated with the capital, that is also another important part, for which equity is becoming the costliest and debt is becoming the cheapest form of capital raising.
Yeah, fully agree with you. Fully agree with you. Yes, thanks for supplementing that also. It is the equity or not, they are the inherent risk taker, because they have the last right on the whatever residual is left out. It is the debt issuer or the lender who has the first right on the. Yes, fully agree with that one. That is obvious. Sorry for having missed out that.
Okay, thank you, sir. Thank you.
Thank you so much, sir, for such a wonderful rendition of the making us known about the real world, financial world. So
I think I was boring.
Educating, no, not exactly. Being an area
because of lack of participation from people.
The finance and economics area. So I personally also get to learn. Yes, these are some things we are also teaching, but it was really educating in terms of getting to know about the practical scenarios, which you have very well correlated. Thank you so much. In fact, thank you.
Number.
So with that, we come to an end to today's session. So we'll start right at 3 o'clock with another speaker, Dr. Abha Mishra, who is the head of UNDP. She will come with a different perspective of a leader's approach. In fact, the role of social as well as the NGO, how do they promote the leadership qualities through that? So thank you so much for the participation, and thank you, Mr. Srimanta Panda, for being with us.
Can I come in? Can I come in if the participants are there or they have logged out? Just a second. In fact, initially I thought I would finish it very early, and I had requested, in fact, Professor Sikta to take over, because I came to know she had a nice presentation also, and different facet of leadership style, including behavioral finance, all that. But somehow I don't know how time passed by. Otherwise, I had intended to. So if she has time, maybe today, tomorrow, before the entire program is wound up, she can share that.
Definitely, sir. Thank you for your kind pleasure. So with that, we come to an end with today's session. We'll meet right at 3 o'clock. I request all of you to join right at 3. Thank you. Thank you so much.